Welcome to the NEI podcast. On this show, psychiatrist, psychopharmacologist, and mental health advocate, Dr. Andrew Cutler sits with renowned mental health experts from a range of backgrounds to discuss breakthroughs and best practices for treating patients with mental health conditions.
Hello and welcome to another NEI podcast. I'm Dr. Andy Cutler, and today we have an interesting sort of companion piece podcast. I have recorded a few weeks ago a podcast with Dr. Jennifer Payne, who's at the University of Virginia, and she's a reproductive psychiatrist specializing in women's mental health issues. And today, I have another UVA connection here. Dr. Dan Singley is a psychologist, and we just found out we both went to UVA. He went undergrad, and I went there for med school. Dan's an expert in men's mental health. Dan, how are you?
I'm doing great. Wahoo wah.
Wahoo wah. Love it. Well, we're going to talk about something, Dan, to be honest, that we really don't talk about enough or even much. We talk a lot because of reproductive and hormonal issues. We talk a lot about women, but we haven't talked enough about men's mental health. And the issues are different. So how about if we start with just a general, how is men's mental health present differently than women's, and why should we even know that it's different?
So first, let me back up. I think it's very cool that this is what you're calling a companion piece to Dr. Payne and some reproductive work. My research is actually on early fatherhood. So I'm very active in the reproductive and the perinatal mental health space. And one question, or sometimes it's a point of pushback that I get, is, doesn't being very focused on men's mental health mean that you're taking away from women or people of other genders? And the answer is no. Sure, there are ways that one could go about doing that in such a way that does hold down other people, but that's absolutely not the way that I or my colleagues focus. So I think, top level, it is not the case that doing men's mental health work means you're inherently pro-patriarchy or male supremacy. There are folks out there that are doing that. My colleagues and I are not part of that. But so it says, there's my soapbox. So to answer your question, yes, absolutely. There are all kinds of dynamics at play that make men's health writ large, but also men's mental health kind of its own animal. And one way to look at this is that men's help seeking, the research around men's help seeking has basically shown historically it's abysmal. We don't do preventative medicine. We wait way too long when we have symptoms, in particular below the belt health symptoms, prostate, testicular and colon and so forth.
Well, sexual issues, of course, too. Yeah.
It's certainly. Although one along those lines, one point that I would say is, because men typically engage in significantly less preventative medicine, like most women go to go see their GYN once a year, and that's at least a touch point, right? Men don't have that. We don't have it. Like, sure, we all know we should go in for an annual. However, it'd be like, it's a point of pride. Oh, I haven't seen a doctor in years. I'm like, dude, you're proud of that? Like, come on. Men die. We die 5 to 6 years younger than women do in this country. And internationally, it's higher. It's like 6 to 7 years. So that's just kind of the backdrop against which this idea about health has very much a gender specific difference, right? At the policy level right now, Health and Human Services has 4 goals that relate to men, and I think like 29 that relate to women.
Gosh.
So then there's
wow.
No, I'm not making that number up.
That's
out there.
Yeah.
Mm-hmm.
Yeah.
But this now sets the stage for the policy question, like, are we getting this on people's minds? And from there, the men's mental health help-seeking piece, there are a couple of researchers out there that developed this approach to understanding masculinity and male gender through the lens of what they call precarious manhood. And the very, very short version of what precarious manhood means is that men, as opposed to women, who these authors, these researchers talk about women having more biologically driven maturation, the onset of period and secondary sexual characteristics, having children if they choose to do so, perimenopause, menopause, and so forth. that generally speaking for men, that it's much more performative, and you are only as masculine as the most recent masculine thing you did in public, and you're always about to lose it, right? And the way I see it, precarious manhood very strongly impacts men's help seeking. And when we do seek help, how it is that we show up. And there's plenty of other ways that, we could look at. There are all kinds of barriers to men getting help. I think it's getting better. We're starting to see a very different approach from generationally, from Gen Z. But for example, one way that it can look a little bit different, those of us that are in this field, the psychology of men and masculinities, this is not a common specialty in psychology, right? But those of us who do, we're very familiar with things like alexithymia, meaning without the words for your feelings, you just don't talk about them, or you're just not connected with them. You may not even know they're there. But also we call it masked male depression or major depressive disorder male type. This is not in the DSM, but we're all familiar with it. And it's a form of depression that instead of sort of like vegetative, can't get out of bed, suicidal, in the corner, sort of rocking back and forth and weeping, the masked male depressive presentation is more angry, like anger, irritability up into rage, a tendency to somaticize more so than I can't be depressed. I'm a dude, right? But I can have muscle tension. I can have migraines, right? And so we sort of somaticize and make physiological what oftentimes has a very strong psychological component. Your average depressed guy will also isolate, but this is very important. You can live in a multi-generational household and be isolated. You can be seeing people at work every day and be isolated. The difference is you're not connecting. You're not investing. So you can still adhere to that traditional male sort of independent stoic thing and be in a crowd of people and still feel isolated. And then the fourth common sort of aspect of this male depressive presentation is increased drinking or substance use. And that's what it is in the literature. But the reality is it's a coping style that involves going overboard on any kind of dopaminergic activity, gambling, risky sex, video games, jumping out of planes, whatever the thing is. So I kind of top level down to some real nitty gritties for you.
No, that's super, super helpful. My gosh, I hadn't thought about all these things. And it ties into something I've thought about a lot, which is, for a man, seeking help can be tied into thinking you're weak. It's a form of weakness. Is that part of the psychology of it?
Oh, 100%. So again, my research is on early fatherhood, and your average dude, and certainly your average dad, when you ask them, what does it mean to be a father? They will say, protect and provide, some version of protect, provide, sacrifice. Well, what part of protect, provide, sacrifice involves looking inward and asserting to others that I have needs? None of it, right? Which is one of the reasons why that I want to do. Can I do a quick sidebar about toxic masculinity?
Of course, 100%.
Real fast.
Sure.
I do a lot of training and presentation. I'll do, hey, quick word association, masculinity. And half of the hands that go up are the popcorns that call out are toxic, right? So yeah, masculinity or maleness or male identification is not inherently toxic. There's nothing inherently problematic. Well,
of course.
You say, of course not. I get a lot of, actually, no, it is.
Yeah.
Really, the hallmark from the social science research, the hallmark of the healthiest men and boys is an ability to, on the one hand, adhere to that traditional male. It's a stereotype, but it's out there, right? You're tough, you're aggressive, you're stoic, you're independent, and so forth. And these are generally admirable, right? Even noble in certain ways. The problem is when a guy can only be that version of a man. He's at work and does a hardcore move in a contract negotiation. He's very aggressive. And then he goes home and expects his partner to go for how high on the way up. And I'm here to tell you that falls apart real fast. And I see lots of that. So the healthy men and boys are able to enact more balance and flexibility to the way they show up in terms of their gender. So you can be that hardcore dude on the one hand, but on the other hand, when the context really calls for emotional intelligence, empathy, compassion, accepting influence from other people, the guy can flip and do that. When you're able to do that, you have better relationships, you have better mental health, you live longer, fewer deaths of despair. Like the list goes on. The problem is, and this was the segue, when you do those things, you are running the risk of that precarious manhood, of being female, of being weak, of being gay. Right. When you think about like all of these things that we have traditionally socialized people, but truly it's balance and the ability to be flexible that's healthiest physically and mentally.
Yeah. Well, one of the things I learned at the University of Virginia, Dan, was to be mentally healthy is to have more options in your coping skills, more arrows in your quiver, or golf clubs in your bag, whatever, tools in the toolbox, whatever masculine kind of analogy I can use. But that's really interesting because it gets me thinking, Dan, are these skills that can be taught?
Yes.
Are these things people can learn how to do? Yeah,
absolutely. And let's wind it back on the front end. First, getting back up on my soapbox here, but hey, I'm on a podcast, right? That's what it's for. We teach boys, and not just boys. It is not just males who gender police each other. Boys, if you walk into like a second grade classroom or a third grade classroom or playground or whatever, you will see excited little boys like running up to each other like, hey, I like Pokemon. Do you want to be my friend? And they run off and play together. I'm like, that is freaking awesome. Then you get to like the sixth grade and it's, it's all good. Like what? And now all of a sudden it's cool to be disconnected and disinterested. And that is learned. That is not like, I've heard all kinds of like behavioral genetics arguments about this, but they are not supported by the research. Men tend to have more and more superficial relationships, whereas women tend to have fewer but more substantive, or just more relationships, some subset of which are much more substantive. So yeah, absolutely. I mean, your point about more, I love the clubs in your golf bag analogy. Yeah, all of it, most of this is learned. Like if we learn as boys, be tough, don't be weak, don't ask for help, well, then you're not going to open up to your friends about feeling depressed and having passive suicidal thinking. You're not going to go get that preventative medicine workup, and you are going to be more isolated. But the reality is there are all kinds of ways to learn to cope healthily, but it begins with, I need to recognize I have something going on and I need to give myself, probably more importantly, other people need to give me permission to not just be tough and there for others. I can do that, but there are other times when I need other people to protect me, to provide for me, to sacrifice for me, to give me permission to be imperfect, not weak. And so learn. I mean, we teach coping skills all day long, like cognitive behavioral work or mindfulness-based work. Different sorts like dialectical behavioral therapy does a lot in terms of how do you handle emotional dysregulation, but then also what are self-soothing activities. These are absolutely learned. Like I've worked with so many men who showed up and their relationship with themselves and then therefore their relationship with other people were sort of circling the drain. But then when they learned basic emotional regulation tools and then some basic assertive communication, don't talk first, don't talk loudest, don't be the one throwing data, don't arrive at a foregone conclusion and expect ask questions, find out meaning and so forth. And basic relationship hygiene tools, they do great. But in order to do these things, you got to step outside the man box. And for some guys, it's like, nah, I'm not doing that. Hell no. Sorry, Dr. Shrink, it's not happening.
I love that term, relationship hygiene. I hadn't heard that before, but that makes, we talk about sleep hygiene. It makes perfect sense.
Same thing.
We all probably know that men are at higher risk for suicide. Particularly, we hear older men, divorced men, single men, all this kind of thing. is that really true, first of all, and men are at higher risk for suicide? And then secondly, how do we recognize that? How do we intervene earlier in it, I guess?
Oh, yeah. 80% of the suicides in this country are males. So,
oh gosh, I didn't realize it was that high. Yeah,
I know. And it's weird because frankly, I'm just going to call this out. The CDC, for whatever reason, tends not to release in any kind of prominent way the gender-based aspects of suicide and more broadly deaths of despair.
Really?
Right?
Okay.
Yeah, and I don't get the NIMH more so, but for whatever reason, I don't get it. But yeah, 4 out of 5 suicides in this country are men and boys. And as you alluded to, typically it has been a bimodal distribution. So it's like you've got the younger folks, and they will attempt or die by suicide. And then for exactly the reasons you just spelled out, these men that are sort of retirement-ish, like, 50, 60, 70. And this overlaps very, very much with what the U.S. Surgeon General has called the pandemic of loneliness.
Exactly, yes.
In our country.
Yes.
Because the reality, so again, my work is in early fatherhood, and onset of parenthood for a lot of men is an inflection point where our social support and connections go down or go away. And we try to get all of our closeness and connection and basically emotional intimacy needs met, typically by a partner. And no matter how great that person is, that's not going to work. And the guy ends up resenting his partner for not keeping him fulfilled. And he's not really open to the fact that usually these days his partner is saying, bro, go have coffee with your friends. I guess they probably don't call their husbands bro, but there we go. But like, honey, go have beer, go play golf, go for a surf, like go be with your friends. But oftentimes, again, the third grader can say, I really like you. Let's be friends and play. The 40-year-old, Andy, I love your show. I love you. Let's be friends. Let's go play. I mean, does that sound a little weird? You kind of, it's a little cringy there, Dan.
I'm backing up a little, yeah.
Okay, fine, but realizing that's over the top, but that's an important part of that inflection point for health for men.
But an age-appropriate way to do what the second grader does, of course, is the thing.
The SNL Man Parks covered that. That's what they nailed it. Where they have all the wives bringing him to the man park, and they're all bashful, right?
Yeah,
As you laugh, but that's why it's funny. It's out there.
No, I'm just thinking from my own experience. I have 2 sons, and early on, I remember feeling guilty about not spending time with them, about meeting my needs, if you will, or wanting to go out with my friends. So you're right. And then, of course, my wife has got to share herself with the child. She's got to pay attention to the child and all that. So she can't always meet my needs. So that's an interesting dilemma.
Yeah.
Well, we talked a little bit about sort of traditional, not necessarily toxic, but traditional masculinity. Stoicism, self-reliance, what we used to call the John Wayne. I don't know if anybody knows John Wayne anymore, but that macho character, choose any movie actor you want to say. This really gets in the way of people seeking help. And as you mentioned, I really like how you formulated the psychological distress, the way it manifests, especially the somatization, isolation, substance abuse. How do we work with that? How do we understand it, work with it as clinicians?
So first, let me say that, in fact, the Duke changed diapers on set.
Okay,
this is documented.
Cool. I did not know that.
I'm an early fatherhood nerd, and I'm here to tell you, John Wayne, the most Marlboro of Marlboro men, was all about it. He had babies on set, changing diapers. I know. I have not been able to find a picture of it, but man, I'm that's the world I insist on living in. I honestly, my sense is I can answer this at we need to have better screening, mental health screening when people go in for visits, of course. But the bigger picture sociological, socio-historic frame is that that age when boys start learning, I'm going to be shamed if I don't enact, like that's what the guy box is for, being tough and stoic and independent. When you live within the guy box, you can't be shamed for being a wussy, right? On the other hand, if you only do that, we already listed all these problematic health aspects of it. So to me, it begins with going back and modeling for these boys and for the people around them that there's a more balanced, there's a healthier way to do this. And up from there, like throughout the lifespan, there are all sorts of steps that we can take. But a brilliant friend of mine once said, if you don't believe that something exists, you won't know to look for it. And I see that applying to healthy masculinity. Most people have never heard the term healthy masculinity.
That's right. Right.
Healthy means flexible and balanced.
Yes.
That's what that means.
It's really interesting what you're saying, because it's sort of like men conceptualize this as an all or none phenomenon. I'm either the dude, I'm all masculine, or I'm nothing. Like there's no in between here. So it is about balance. That's interesting. Yeah.
And that sort of zero sum, all or nothing frame very much undergirds this precarious masculinity experience of always running the risk of being shamed. And so being able to know that and realize there are other ways and there are groups and people and organizations, and just, I'm not talking about like shrinks necessarily. I just mean like people out there on the playground or at your golf club or whatever, who are actually more fully functioning, that won't shame you for being like, yeah, I'm kind of having a tough time with my wife or my kid or whatever. Like that's the ability to be open and vulnerable and to feel safe in relationships when you do it is as important as water or food.
Yeah, so it's taking a risk. Well, here's my bias, Dan. My bias is if a man shows up in my office, there's an issue, right? There's a problem. There's an issue. So now it's not so much like you said, screening and whatever. I know there's an issue. But this issue now of how do I break down the barriers? How do I build the trust? How do I engage with this person, in order to get to the next place that we want to get to?
My general approach here is to never shame men. Like once you do this kind of work, you come to understand how centrally the role of shame, or even the possibility of shame or vulnerability, is a governing psychological and interpersonal dynamic for men. So I never shame. I do not condone bad behavior by men. At the same time, I'm not here to shame them for being who they are. And I'm always listening for, how do I come to you? How can I come to understand you? I'm not going to you people you. You're such a guy. Like I want to get, and the words that you use, the words you don't use, the ways that you describe yourself, the things you do in your community, that helps me to come to you. And a lot of times your average dude, certainly like of a certain age, like, past 30, is very unlikely to come into an appointment with you and say, Dr. Cutler, I'm feeling ashamed and depressed, and I'm very worried about my, erectile dysfunction and how that's playing out. Like what they're more likely to do is to come up and say, yeah, things have been a little rocky, or I feel like she's taking shots at me, or I'm way out on a limb. Not trying to squeeze emotions out of these guys, but if you know what to listen for, they're usually like, I let it roll off my back, or it is what it is, means this sucks, help. But it's just, guys aren't socialized to do that. So I think these are very important. And certainly when it comes to, so again, my research is on, wait for it, paternal perinatal mental health, right? Which is the smallest of ponds in mental, but that's why I think it's cool. You had Dr. Payne talking about women's reproductive psychiatry, and mental health. But 1 in 10 dads gets postpartum depression.
Really? Oh, there you go.
And nearly 20% at some point will have an anxiety disorder. I don't just mean you're stressed. I mean generalized anxiety, post-traumatic stress, acute stress, full phobia, and so forth. About 20% will develop an anxiety and or comorbid comorbid anxiety and depression. And these are huge public mental health numbers, but people just don't focus. When you say, oh, she's got the postpartum, we think it's moms, we think it's women, and it's only birthing people that'll get it. This is not true. So I get asked this question a lot, like, so how do we talk to the dads? And I'm like, okay, are you ready for some next level, like super complicated psychological intervention? It goes like this. First, you square off with him and you say, hey, Dad, how are you doing? And then you wait for the platitude. It's all good. It is what it is. The deflection. How are you doing? You wait for it, let that pass, and then stay squared off, eye contact, and say, hey, Dad, how are you really doing? Lots of people do the first part. They don't do the second part. And that oftentimes, just that, it creates a sense of interest and openness, like, okay. I mean, the guy may not open up after that, like, that's fine. But to me, that's a very straightforward way to try to at least set the table. And that's not just with dads, dads with depression. That's with anyone, particular dudes.
Sure. No, that's pretty straightforward technique, but sounds effective. It sounds like
I took a whole class in that. How do you feel? How do you feel? Andy, how do you feel?
How do you really feel?
Exactly. It's a whole practicum you have to take.
Yeah. So I guess your point is that we shouldn't just be asking the moms. We should be, and especially when a woman's pregnant, let's say, we should just start talking to the expectant father, not even after the birth.
At least set the expectation that they're part of it, right?
Okay,
hops back up on soapbox. The field of perinatal mental health is usually referred to as maternal mental health. While there are pockets that are exclusively maternal or like trans or whatever, generally speaking, it's parental mental health. And so again, from a psychosocial perspective, you ask like, well, why didn't I know that about men? The field is called maternal mental health. No one's looking around asking, well, what about the paternal part of maternal? There isn't one. And so that's, when it comes to sort of policy perspective, one of the things that my colleagues and I push really hard is we need to be gender inclusive. We need to talk about family mental health, parental engagement, and mental health. So this, to me, that's, again, see above comment. If you don't know something exists, you won't look for it.
Yes. My experience, Dan, has been men are not so great at transitions. Women seem to do transitions better. And what I mean by that is becoming a father is a major transition. You're single, you're out there, you're a player, you're doing your thing. And then now all of a sudden, this is a major role transition and a major kind of mental shift. And that's hard, I would think, for a lot of men, and maybe even stressful.
It is. So my colleague, Darby Saxby, she's a professor of psychology at USC, and she and her lab have done bang up longitudinal work that addresses neuroendocrine, hormonal, biological, as well as relational and psychological factors of moms and dads, but with a particular focus on how this plays out for the fathers. And she wrote a brilliant paper that I was kind of ripping off before when I talk about fatherhood as an inflection point, as a health inflection point in terms of social support, in terms of diet, in terms of sleep, and in some ways in terms of, and she doesn't get into this stuff, but our relationships with ourselves. And what I mean by that is, if I have let me back up. Generally speaking, men tend to externalize psychologically. And externalizing means if there's something out there that's bothering me, my answer is that thing needs to be different, then I won't be bothered. This is a very sort of overgeneralized, but like externalized frame. Historically, it's interesting. The most recent DSM actually makes for the very first time a gender-based distinction in the major depressive disorder description, where women are more likely to be internalizers, to go inward and to be very self-critical in that way, and to have greater awareness. Well, your average dude, when that thing bothers me, rarely stops to ask himself, what is it about me that makes what that person did or what that person said or what didn't happen? What is it about me that makes that upsetting? Because it's obviously I'm right about everything I think and I don't have needs. This is just the way the world needs to be. That needs to change. No duh. So one really key aspect of doing this work is to kind of slow the guy down and be like, hey, so when she said that, it was upsetting to you, right? Uh-huh. What do you think it means about you that that's upsetting? And that can take like 8 sessions depending on the guy.
Yeah, sure. So it's a dynamic. It's a dynamic between the environment and you, if you will, and your issues, your coping skills, all that, your worldview.
Again, I index heavily on the fatherhood stuff. But I mean, for those of y'all that have kids, raise your hand if you didn't come home after a long day and no one's around, but there's like a little plastic plate with some dino nuggets and you're like, screw it. So I guess that's what I'm having because it's around. Well, that example generalizes very much. And so for a father and, men generally, our relationships with ourselves change. If my version of fatherhood is protect, provide, sacrifice, then we call it the paternal role salience. Like my sense of fatherhood, my role at the identity level means I'm coming to see myself differently than I did, as you pointed out, when I'm 25 and running around and
swinging single,
and so on.
Whatever, yeah.
Exactly.
Yeah. Yeah, this is something I don't think we talk about enough is how men's identity shifts, their self-view, if you will, shifts. I mean, it's still through the prism, as you said, of that provider, protector, dude kind of thing, but it does change over time.
Andy, that conversation is hard to have when everyone's worried about culture wars these days and what it means to be a man, right? At the end of the day, 50 years post-Title IX, and even more than that, the wide-scale availability of the birth control pill have forever changed the upward mobility and the options that girls and women. I'm not saying, hey, we're great, we're all in some equal playing field. That's not what I'm saying. I'm saying significant gains have been made to lift up girls and women over the past. I mean, that's a generation over the past 50 years or so. And while that's been happening, there's also been kind of an evolution of what it means to be male. Like if you have way more women in the workplace, the domestic duties that we have traditionally called feminine, they're not going anywhere. Somebody needs to do it. And, this is where the whole second shift and emotional load and mental load stuff comes up. But when you start talking about fatherhood, identity and role, there's a certain subset of folks that are like, you're just trying to turn men into women. And that, I get this a lot, coming out of academics and the APA. And that's very, very different than what I'm actually trying to go for. But a lot of folks, some folks see masculinity as under attack. I see it as under construction, right? I have a colleague of mine calls it where we are updating the male operating system. And that's the way that I see it. And historically, it's very important to understand there hasn't been a time in recorded history when everybody thought masculinity's fine, it's not under attack. 400 years ago, the King of England is worried that tea is going to make men and boys lethargic. The Boy Scouts were largely started in this country because boys were forgetting what it was to be a man, right? So this anxiety about men are losing their masculinity.
Right.
It's kind of the societal precarious masculinity. And it's out there. It's so important for people to understand.
Yeah, there it is again, precarious masculinity. I love that.
It's out there.
I was also taught around the concept of loss and how important loss is. And when loss was defined for us in residency, it was real loss, threatened loss, but also perceived loss, which can mean if I lose a little bit of my hair, let's say, I'm now not the man I was or something. So you see what I'm saying? I think men are very vulnerable to that.
So grief and loss
are
about much more than death.
Right.
They're about losing a perceived loss of something which is very value congruent, very important. And so this absolute, I have worked with many fathers who had a medically uncomplicated pregnancy and birth healthy transition generally into fatherhood, and experienced a significant loss related to, well, here's the kind of guy I used to be, but here's who I am, here's who I have to be. Here's the relationship I used to have with my partner, but now it's different. And you earlier talked about guilt, and talk about, I don't have an entitlement to look after my self-care. Oftentimes, I see overwhelmingly heterosexual couples, although we do see dual dad and some gestational trans dads. I'm in Southern California, so here we are. But you'll hear these guys come in and say, look, she's up all night with the baby and her nipples are cracked and she's touched out and she's doing all the heavy lifting. What right do I have to go play an executive course? And that guilt contributes to the sense of loss, because oftentimes without even discussing it, it's, well, that part of my life is over. I'm like, doesn't have to be. For me, surfing, I'm a big surfer, right? And it doesn't mean I'm a real good surfer, but I'm very enthusiastic. But I used to be able to just kind of drive up and down the coast and wait for when the wind and the tide and the conditions were perfect and so forth. Now I'm surfing dawn patrol at 6 o'clock, and I'm going to go out there and get my stoke, and then I'm going to work, and it looks different because I'm a working guy and I'm a father and I needed to be home and take the kids to school and all that.
Sure. Wow. Yeah, I definitely see what you mean. We talked earlier about how, let's say, depression or anxiety can manifest differently in men, but particularly when we're talking about new fathers, as you said, things like, irritability, emotional withdrawal. But something we didn't talk about too is how male identity is so tied up. You said being the provider, it's so tied up in our work. So much of our identity is tied up in work and career, if you will. So I could imagine people just throw themselves harder into their work, which makes things even worse as well. Is that something you see?
Oh, yeah, absolutely. Yeah. I mean, so again, men broadly, but here I am, I inevitably get pulled back to fatherhood. A lot of the dads that I work with that have gone through the birth, pregnancy, birth, and sort of fourth trimester, first year postpartum, that were really stoked about being dads and wanted to be in there. And the word that they use very commonly is, Doc, I felt invisible. What do you mean? When people wouldn't answer my questions, they wouldn't look me in the eye. That crappy futon in labor and delivery was a clear sign they didn't want me there. But all sorts of things like that. And so as we look at these dads and ask them hey, what do you think your role is? What's your importance here? A lot of times they don't know. And they feel resentful and upset, but oftentimes simply don't know how to have the conversation, or don't know how to have the conversation in a productive way that's not just emotional rock throwing. Right.
So these are skills, again, we can try to teach. I love that idea of relationship or communication hygiene, I guess, is part of it, because frankly, a lot of us don't learn great communication skills in our families of origin. Let's just face it.
Oh, ask anybody about Thanksgiving, especially these days. But in particular, it's a number that we do on boys. Boys learn very early. Look, talk first, talk loudest, fact stack, give the data, because if the other person's talking, you're losing. It's none of that is true. In fact, that's terrible assertive communication. It's not productive conflict. However, it's being tough, it's being hardcore, it's being smart, it's being successful, but it usually does not result in better relational scar tissue where you're stronger afterwards. It usually just causes more distance and damage.
Yeah. One of the concepts I learned in residency was the difference between being assertive and being aggressive. And that was a little bit of an eye-opener for me, too. That some people, I think, are afraid if they're assertive, they're going to come across as aggressive. And there's this middle line here. It seems that that's part of teaching men to communicate. Am I right?
Andy, let me, I got my own answer on this, certainly. But when you think about how pop quiz, how do you distinguish, like when it was explained to you in med school, like what was the distinction between assertiveness and aggression, if you recall?
Yeah. No, assertive is expressing your needs and getting your needs met. Aggressive is trampling on somebody else's, so to speak, crossing a line, if you will. Does that make sense?
Agreed. And the way that I look at this is actually when we do this, that this is a component of some patient's treatment plan or whatever, is we talk about communication as being on a continuum with aggressive on one side and passive on the other, and assertive is right in the middle, right? And some people, colloquially will use, I was assertive as hell, like I punched him in the nose. Like that's not what that is. I frame it in terms of needs and what's my focus on needs. If I'm being passive, I'm basically abdicating my needs and I'm going to just let you have yours. If I'm being assertive, I am as focused on your needs as I am on mine. If I'm being aggressive, exactly like you said, I don't give a crap about your needs. It's my needs that matter. And learning how to do that, like that's one of the reasons people are like, oh, just ask a bunch of questions, you shrink. I'm like, okay, yeah. And if you're having a significant disagreement with somebody that's very important to you and it's upsetting to you or that person, the best thing you can do is first, just stop talking. And then learn to ask questions that are about the other person's meaning. And if their meaning doesn't square with what you want, don't contradict them. They're not wrong about their subjective frame. But the problem is, like, guys are trained to be like, no, if they're saying something I disagree with, they're winning. I'm like, no, they're not, man. Like the people that are most likely to come to a difficult agreement are the ones that feel understood, not the ones that you're trying to intimidate.
Okay. Yeah. Wow. So again, these are skills, I guess, that can be taught. First of all, we have to teach males how to identify their needs, I guess, which is a big first step, right?
Well, and to not shut down other people that are noticing, hey, you're not getting some of these needs met. Hey, you seem depressed. You seem isolated. You're drinking too much for my comfort. Like, first, a lot of times it's being willing to take it in. And for a lot of for example, postpartum dads that have postpartum depression, I mean, the heart of depression is, I think I suck. Everyone else thinks I suck. The world sucks. The future sucks. Everything's crappy, right? And then I can use my baby to do that, right? My baby loves my partner. My baby hates me. We're not attached. I'm a crap dad. And that's what the one aspect of the dad's postpartum depressive presentation can look like. But I think, sort of sorting through that with these dads and really asking them to look at, hey man, you're talking about protecting and providing. Are there some ways that you're not showing up that you would like to? And at the end of the day, not shaming them or shoulding them, but rather saying, look, man, like, here's the deal. The research on this front is very, very straightforward, which is to say that after you get basic needs met, I mean, basic needs, shelter, food, what the research says that the most important thing that you can provide to your baby and to your family is the healthiest version of yourself. And these men are not used to thinking of we are something that we provide to others. Again, go back to that whole like externalizing frame, right? But a lot of times that's one of the ways that I think it's really important to be able to understand traditional aspects of masculinity without crapping on them necessarily, but to be able to sort of meet them where they are and say, yes, protect, provide. And you're going to be a better protector and a better provider if you are doing what it takes to make yourself healthier. Call your friend, go for a walk, sleep a little later, whatever it takes.
Yeah. So one of the things we haven't talked about then is the mental health of the father during this perinatal period, how it affects family dynamics and the child's development. You're starting to touch on that here, but can you elaborate a little bit more on that?
Yeah. I mean, a family is a system, right? Think about a spider web. If you flick one side of the spider web, it resonates all throughout the rest of the web, and family systems are exactly the same. And one of to me, one of the most important and in some ways shocking and enlightening prevalent statistics in perinatal mental health is that the strongest predictor of all that fathers will develop postpartum depression is their partner develops postpartum depression. There's a 1 in 2 chance. So 50% of the time, 50% of the time, when most of this research is done on heterosexual couples. And so typically it's the wife gets depressed and then so does the dad. And 50% of the time, like above and beyond, if the dad has a history of major depressive disorder at any point in his life, that is not as strong a predictor as his partner getting depressed. And that simply speaks to the centrality of the relationship to both of their mental health. Like it goes the other way too, like rising tide floats all boats. You can get when one starts doing better, they can bring the other with them. But there is such a need in perinatal mental health to focus on families and all parents and families as a system. There are all kinds of barriers that make it more challenging to do that. But most people will sit up and say, yeah, agreed. However, we don't have time, we don't have the resources, productivity requirements, and so forth. But the question you're asking about the family and the resonance and one impacting the other, it's not a question, it's a fact.
Yeah, makes sense to me. Many of us were trained in systems theory, of course, too, and object relations and so on. And that certainly talks about exactly what you're talking about here. And I liked, the spider web analogy. I hadn't thought of that one. That was a good one.
Mm-hmm.
We're getting close to the end of our time, but I want to focus on some practical things, some practicalities. So for those, we have our audience is not just clinicians, there's lay people, but for the clinicians in the audience, what steps can they take besides the fact that you're helping us to raise our awareness of these issues? And whether it's in screening, language, psychoeducation, to make mental health care more accessible and acceptable to men, navigating early fatherhood, but maybe also in general throughout areas in their life.
I was just reading, it was a New York Times Magazine article that was talking about an outfit called, I think it was the Cutler Clinic, and it's a men's clinic.
It's not no relation.
Yeah. There you go. Yeah, this is nepotism. You get money for every click. No, who got like a $15 million donation from a former patient to set up this clinic that soup to nuts, big picture to small, is guy-centric. They'll have the way that the space is set up. There's like a putting green and a coffee bar, and there's sports on TV, and you overlook an athletic. So a lot of this is kind of like that traditional, which is important because even if you don't rigidly ascribe or prescribe to that, you recognize it. And they talk about members, not patients. And setting, so for example, our clinic here in San Diego, we're called the Center for Men's Excellence. And our branding is very much intended to directly address, this is for men. Now, mind you, it's not just for men. It's like I said, we have like female and, patients of, queer and gender nonconforming and all of that. However, men seeing, hey, this is a place for men, and then they see excellence, right? In the medical model, as applied in mental health, it's you're super depressed, let's get you less or not depressed. Well, that isn't thriving. And I think an important part of inviting men into this health space is to tell them, dude, you deserve to feel better. You deserve to thrive. People deserve to thrive, but dudes hear this very, very rarely. And to then give a roadmap for what does that look like? Is it leading a more value congruent lifestyle? Is it, I'm going to go exercise more? Is it, I'm actually going to take a risk and kind of open up to a friend of mine about it? But like, this is what we in the men's field call the butts and seats question. Like, how do we get the butts in the seats for the dad's class as patients, like this? And so we're looking at this stuff all the time. And there is like research literature around like social learning theory and gender and so forth. And it's tricky, right? Like, so an example would be, I do a lot of consultation with different organizations. And so like a neonatal intensive care unit, right? Perinatal reaches out and says, hey, we want to start engaging the dads better. How do we do that? I'm like, well, what did you already try? We had pizza, beer, and football night. And I'm like, that is way better than nothing, right? However, for dads that might have a complicated relationship with alcohol, for dads that may not be particularly into football, for dads who themselves may just have some social anxiety, period, or feel like I'm not the typical guy, so that's not for me. So I stand by, that's better than nothing because you're showing, hey, we're thinking about the dads, but you're going to lose a subset of them. And so finding ways to be inclusive that are, it's actually the way people think and the way that people talk is tricky.
Yes, it sure is. Yeah, that's interesting. I give him credit for trying, like you said, but it's a very traditional kind of version of what a man is and likes, I guess.
Well,
it's
on
1950s.
us, Andy, for you and the clinicians and the lay people out there, I'm here to tell you, and you can quote me on this one, there's nothing wrong with tricking dudes, honestly.
Right.
I mean,
I get
a
that.
straight up bait and switch, which is
Bait and
like,
switch.
men, dudes. And then you get him in the room and it's like, hey, so who here kind of struggles with some guilt about being a father? There are no parents without guilt and regret, or the same thing. Like, so we run a lot of men's groups, right? If you want to kick off a men's group, get 5 or 6 dudes around a table and be like, hey, where'd you learn to be a man? And as the facilitator, you probably don't have to do anything because no one asked them that, and they'll get to talk about it, right? But it's just oftentimes just giving permission to acknowledge that, like, men usually don't deal with gender, and they say that white people usually don't deal with ethnicity, right? When you're a member of this group, typically you downplay it. And so your average dude, like, we'll do strengths-based work, where I'll have them take a strengths profile and they come back and what are their top 6? Achievement, extroversion, winning others over, like whatever it is. And for a lot of these guys, the prospect of saying, these are ways that I am strong, is scary because they've been beaten down for being oppressors and being cocky and being arrogant and so forth. But when you step back, really at the end of the day, balance and flexibility requires that I can say, here's what's wrong with me, but here's what's right with me. But like, you want to mess somebody up, Andy, roll up to your colleague, just roll up and be like, hey, what's right with you? And just stand there and enjoy the awkward silence. And be like,
yes,
what?
Exactly.
But that cascades up. Like, how can we be fully functioning? How can we be balanced if the prospect of talking about strengths and positive psychological functioning is verboten topic?
Yeah, I love that framing, Dan, because this is something I've talked about before in the podcast. What I like to do a lot of times with, let's say with kids who are coming in for ADHD, I'll say to them, Mom, they're going to start off with all the things that are wrong. I'll say, well, what do you like about this kid? What are they good at? What are their strengths? Because you also want to build on that. Like you said, it needs to be balanced. It's not just let's lessen the negative or fix that. People are whole. They have pluses and minuses. I really like that idea of focusing on and giving people permission to be okay with their strengths as well and to not feel like, again, it's not a zero-sum game. It's not you throw the baby out with the bathwater. You get rid of those to have the other. It's not all or none. So, yeah.
Well,
yeah.
Along these lines, so I do leadership and governance, and one of them is in the American Psychological Association. There's a division 51 that focuses on the psychology of men and masculinities. I'm the past president of it, and our current president, Brian Cole, who is brilliant, just gave a really, really awesome talk on healthy masculinity and positive psychological functioning in gender and for men in particular. And it's just a message that needs to get out there.
I agree.
So much.
Yeah.
To normalize.
Right. It's not all or none. It's not, toxic masculinity versus being a wussy. I mean, there's so many other places in between here.
Andy, I'm telling you, the people that I know that squawk the loudest about the other side being zero-sum, all or nothing, usually themselves are fairly zero-sum in their frames. Yes. They just don't realize it because obviously they're right.
Yeah, exactly. Well, Dan, I want to leave people with some practical things here. Where can people learn more about this or get more information? Feel free to tell me your website or other resources that people can find out more.
Yeah, sure. We've got, blog posts and videos and resources at our website, which we're the Center for Men's Excellence. It's www.menexcel.com, men like man plural, and excel like the Microsoft product.com. Also, I mentioned the American Psychological Association. You can go to division51.net. We have a bunch of information about men and men's mental health there. For folks that want to go more into the fatherhood stuff, we have plenty of that on our website at menexcel.com. But there's another outfit that I work with called Postpartum Support International. I've worked with them for probably 17 years at this point. You can go to postpartum.net, and we have plenty of information about fathers and support groups for dads in the immediate postpartum, which are very difficult to find, but they're there if you go to postpartum.net. So those are a few. Also, if you kind of want like a lighter side of things, go to mantherapy.org. It's like Ron Swanson became a therapist. A colleague and I helped to 3.0 their site with some newer content. But it makes mental health more approachable for dudes,
Cool.
Let's say.
Well, that was mantherapy.org, did you say?
Yes.
The last one?
Yes.
Mantherapy. Okay, I'm definitely going to check that out. Well, Dan, thank you so much. I can't believe how fast the time has passed. This was really, really fun and exciting and informative. I certainly learned a lot, and I really appreciate your time. Any final thoughts?
Oh, I really, really appreciate you having me on. And as I say, I really enjoy the idea that this is a companion to the repro psychiatrist that you had on, because we don't usually talk about men needing support or men's mental health. So thanks for having me on. Yeah, no, that's a good point. I like that, because that was a theme that we talked about, is the idea of balance. It's not one or the other, all or none, zero-sum game. So yeah, in a sense, that's what this was. All right, well, thanks so much for listening. For more information about our educational offerings, our meetings, our products, please go to our website, which is www.neiglobal.com. Thanks for listening.
Thank you for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today. For more information about NEI and our premier educational content, please visit neiglobal.com.